Well, the benefit of BHRT, bioidentical hormone replacement therapy, is the big one is that your body gets back what it used to have to be well and to perform well. It stops aging, or at least slows it down. It sort of allows you to stop the clock. It allows your body to deal with stressors of life easier. It prevents you from just going downhill because of inflammation. So those are the main benefits. Now, when you go through each one has its own role. Cortisol, most important hormone. It's a stress hormone or survival hormone. We would be dead without it, so it's very important to have. Now, when there is constant stress and inflammation, and stress can be physical or chemical or psychological, regardless of what kind of stress you are under, or it's just aging with its inflammation processes. Every time your body is under any kind of stress, your cortisol will react and it will get higher. And it helps you to get through in the short term. But if you're constantly under stress because you have chronic illnesses, your hormones out of balance, something else is going on, you're not eating the right foods, so body is deficient, you're eating things you're allergic or sensitive to, so that causes inflammation. You are exposed to so many toxins through your food or through your daily skincare or through some other things. So regardless of what kind of challenge you're under, if body has to go into survival mode and deal with this inflammation, cortisol will go higher and higher and higher. Now, as our cortisol gets higher and higher, short term, it's a great survival skill. Long term, it actually makes you more inflamed. People start having food allergies and sensitivities and chemical sensitivities. They lose sleep, those tired and wired. I'm really tired, exhausted, and I can't fall asleep. That's your cortisol out of balance. So short-term, great. Long-term gets toxic of itself and actually causes more and more inflammation. Now, if your cortisol was too high for too long because you were under the same stress for too long, eventually your body makes less and less and less. And as your cortisol goes way downhill, there are different risks. First of all, you will see when your cortisol goes up, your belly fat will start creeping up. And those are people in their 40s, and it's first just as a hormones out of balance. And people come and say, I never had that belly, where did it come from? And I exercise like crazy and I barely eat and it's still getting bigger. That's your cortisol driving that. And so it really needs to come back to balance for you to have that normal flat belly you used to have. When cortisol gets depleted and your body makes less and less and less because it's exhausted, people start having higher risk for autoimmune disease. People will have arthritis, they will get achy, they'll get stiff. Then, of course, your risk for cancers will go up simply because if cortisol is not balanced, then your immune system cannot be balanced. And it's your immune system ultimately that watches over to make sure that those cancer cells we make get killed and eliminated quickly and don't have chance to grow. So that's your cortisol. Now, next layer, thyroid. Thyroid hormones are very important. They determine how fast is your metabolism. You have too much, you're super thin, you have racing heart, and you have a whole host of problems. Most of people actually have low thyroid. And that can come from chemical stress, that can come from toxicity, that can come from unbalanced cortisol, or it can come from autoimmune thyroiditis called Hashimoto's, which about 90% are actually not diagnosed. And so we see a lot of these people, they come, they gain weight all over their body, and it keeps going up. They gray out early. They may start losing hair. They have depression, or they just don't feel like doing anything. They're constantly exhausted. They're the ones who you see will be freezing in July in Florida and carry a sweater with them to Disney World. So it's always cold because their metabolism is just not there. Everything is super slow. And they go out on a limb to exercise and eat right and change million diets, and they still keep gaining weight. So that's your thyroid. Can be balanced, you can feel great, and yet, like I said, 90% run around feeling desperate, trying to find their answers and not being able to help themselves because their thyroid needs to be balanced in a specific way. Then next one is insulin. Well, with age, when cortisol gets out of balance and we have more inflammation, your body deals with it by insulin resistance. In other words, your body makes insulin. In fact, it makes more and more insulin, and yet body is less and less sensitive to it. So what happens is your insulin goes up, which means your inflammation goes up, which means your belly fat goes up, and your blood sugar goes up too, because body is not sensitive to insulin, so it doesn't remove that blood sugar out of bloodstream. So it means more inflammation. With aging, people start having insulin resistance about 10-15 years before they get prediabetes. And then 10 years later, there is diabetes. It's a lifestyle disease. It's fully preventable. There are ways to balance out your insulin. But again, if cortisol out of balance, it will drag all hormones out of whack. The next hormone is estrogen. And both men and women have it, but women certainly have a lot more. Estrogen, when it's balanced, means that beautiful skin that we'll have when we're 20, in our 20s and 30s. It means nice, lustrous hair and face and shiny eyes. But more importantly, it means healthy heart, strong bones, strong, good breast health, good uterine health, good cycles, good fertility when we are in 20s and 30s and 40s. Estrogen is extremely important. There are about 300 places in the body that will have estrogen receptors. One of the most important sites is brain. So when women go through menopause and they lose most of that estrogen, they're at higher risk for dementia, they're at higher risk for heart disease, they are for heart attacks specifically or strokes. They are at much higher risk for osteoporosis, and many women will have hip fracture because that was missed and not treated. And then, of course, when estrogen is out of balance, if it's too low, women start having hot flashes, and it's annoying, especially if it wakes you up in the middle of the night, and she has to wake up and get up and change the sheets, and people hate that. And then they have trouble sleeping. Well, in 40s, another hormone we will talk about in a minute will go down. So in 40s, you actually have relatively high estrogen. And that makes you so strong and feeling great in your 40s. But it also will determine, as the more you get a slide into that imbalance, the more women will have heavier, larger hips and have more fat in the butt and in the hips, and nobody likes it, and people try to exercise and it doesn't help because it's not about exercise is great for you, but it doesn't help with that estrogen progesterone imbalance. So when women lose most of their estrogen with menopause, estrogen is natural antidepressant. And so women feel depressed and the mood is all over the place and their husbands hate it because all of a sudden she's tearful and then next minute she's monstrous and she's screaming at kids and she's shrieking at him and he can never predict when it happens and why it happens. And then she cries because she feels like a terrible mom and she really doesn't know why she does it, and then it happens all over again. Next hormone, again, can be balanced. It's important to test it in the right way. And then you can bring it back to balance regardless of what age you are. And of course, when you are in menopause and your body just no longer makes enough, with BHRT, we replace that hormone with bioidentical hormone so you can have it back and you can have your life back. And of course, we don't try to restore periods by any means. But if hormones are started early enough in 50s, there are a lot of studies now that show 42% less mortality. In other words, we are 42% less likely to die of any causes if we are replacing our estrogen and other hormones in menopause, and if we start doing it between 50 and 59. And there are benefits even if you start doing it later on. It's just less benefit. We have less risk for dementia, we have stronger bones, so we don't go into osteoporosis. So it allows us to prevent a lot of diseases if we balance hormones back to normal. And it just gives us better quality of life. Estrogen is also a go-getter. It's your ambitious hormone. It makes you want things. It makes you want to do something and perform and have fun. And of course, it's important for sex life as well. The next one is progesterone. Progesterone is your Hakuna Matata hormone. It makes you calm, it's natural anti-anxiety. So progesterone is the very first hormone that starts going downhill in your early 40s and in some women even in mid-30s. And estrogen and progesterone always play together. It's important to have balance. When progesterone goes downhill, even if your estrogen is normal, but now that it doesn't have its counter, its friend to play with, all of a sudden you have what we call estrogen predominance. And that's when women start having mood swings and gaining fat in low part of their body and not feeling well and having heavier periods and growing fibromas sometimes and having those heavy bleeds that for many women end up with hysterectomy and so many other things. So progesterone is extremely important. Again, we have receptors all over your body. Brain has the most receptors for progesterone. So when in traditional medicine years ago, decades ago, we came up with the idea that if a woman doesn't have a uterus, she really doesn't need her progesterone replaced. That did lead us to eventually to a lot of risk factors. So it's important to replace both, whether a woman has her uterus or not. It determines breast health. I mean, it's very important. And then, of course, king of the fields, testosterone. FDA believes that testosterone is important to replace in men, but it doesn't improve it for replacement in women. However, if you think about it, if you look strictly at the levels in middle-aged woman, you actually have 5 times more testosterone than estrogen in her body. And so testosterone is obviously super important. Testosterone is important for bones. Again, it prevents osteoporosis. It's important for your brain. Testosterone is your driver to get things done. And so often women come to us in menopause, and certainly men come to us in their 50s or 60s. I just cannot get anything done. I don't feel like it. I don't care anymore. And of course, testosterone drives everything sex-related. Your libido, your lubrication. Without testosterone, sex becomes painful. So many women avoid it. And of course, that often breaks relationships or at least puts a strain on it. And so, and then of course, it's a major sex driver for men as well. Libido and everything sex-related is mainly, testosterone is the biggest driver. Although estrogen is part of it, progesterone is part of it, but testosterone is the biggest driver. So again, multiple places where testosterone works. Your brain needs it, your vagina needs it, your uterus needs it, your bones need it, your muscles need it. When men start losing their muscle, men and women, when they start losing their muscle mass in 50s, that's low testosterone. When men and women say, 10 years ago, I would work out a little bit and I would have this great shape, and now I work out so much more and nothing happens, that's low testosterone. And so that's important to check and adjust and optimize. And the important thing to understand, often in traditional medicine, we find one number and we tweak one number, one hormone, everything is related. And so it's important to work as a practitioner that understands the whole picture so you can work with the whole picture, because we're not one hormone running around. We are this beautifully created complex system where everything influences each other, everything works together. And when one thing is low or too high, everything else cannot be balanced, and so things go out of balance. So you really have to restore the whole health, not just tweak your hormones. And we see it in our practice sometimes. People come to us from different practices and their hormone numbers look okay, but they don't feel well. And I still don't feel like myself. And often optimizing how gut works, or how your body flushes out toxins, or how your liver works, or are you doing the right things in terms of your lifestyle? Are you eating the right things so your body has nutrients it needs? So all of those things will influence your hormones. But ultimately, once we get into 50s. For sure, hormones need to be optimized if you want to live longer and live better and just ultimately love the way you look and feel.